It's Helen Normoyle and Dr. Clare Spencer here, and we're the co-founders of my Menopause Centre. So the theme for this year's World Menopause Day was bone health. And so what we're now going to do is have a very quick chat around bone health and why it's so important, particularly as you go through the menopause. So Clare, I guess that's the first question to ask you. Why is bone health so important, particularly as women start to go through the menopause transition or the perimenopause?
Yes, thanks, Helen. Yeah, so bone health is a really important factor to start considering because as we go through the menopause, as we start that transition in the perimenopause, our estrogen levels start to drop. And estrogen is really important for the maintenance of strong, dense bones. So we know that as we go through the menopause, bone density, so the strength of the bones, can start to decrease.
And how would I know if I'm at risk of having poor bone health? And what are the things that I should be considering?
Yeah, so there are certain risk factors as well as the menopause that increase your risk of osteoporosis. So for example, if you're very low body weight, if you have a medical condition that means that you can't absorb the building blocks that you need for bones, for example, calcium, so people who don't absorb well from the gut. There are lifestyle factors that increase the risk, for example, drinking too much alcohol or smoking. Osteoporosis can run in families, we know that, and so actually your genes, your genetic makeup might improve your risk also. There's certain medication that can increase your risk of osteoporosis, and also we know that the risk increases with age for both men and women. So it's really considering whether you've got any of those risk factors, but also considering this more as an issue as you transition through the menopause.
That's really helpful, Claire. And then you mentioned osteoporosis. Now, what actually is osteoporosis and how would I know if I had it?
Yeah, so osteoporosis is the medical condition where your bones become less dense, they become more brittle, more fragile, and more prone to breaking. And a lot of the time, actually, you might not know if you've got it unless you had a special type of scan called a DEXA scan. And that's a scan that actually measures your bone density. For some women, as they increase in age, their height decreases. So that can be one symptom. And because your bones become more prone to fracture, you can get little fractures in your spine, which means also, as well as reducing height, posture changes. So the spine can become sort of overly curved. And there's a medical term for an overly curved spine called a dowager's hump. I don't know if you've heard of that, but that can be a sign of osteoporosis.
Yeah, Claire, when I first heard that term, it really reminded me of my grandmother because she had that as she grew older. She became really stooped and had that hump. And I only thought of it when we were chatting about this and thought, wow, she must have had osteoporosis. But clearly she didn't know, and thankfully she never had a fall. So if I am at risk of having osteoporosis for all the reasons that you mentioned, what are the things that I can do to look after my bone health?
Yeah, so you can help reduce your risk by making sure that you've got enough calcium in your diet and enough vitamin D, because we need vitamin D to absorb as much calcium as we possibly can. If you're smoking, stop smoking. If you're drinking too much alcohol, reduce the amount of alcohol that you have. Talking to your doctor about it, and if you are at risk, they can request a DEXA scan for you, so you can actually find out what your bone density is. And then, of course, if you are transitioning through the menopause, considering HRT is so important because we know there's good evidence that HRT can help prevent osteoporosis, and it can help improve bone density if you do have osteoporosis already.
That's really good to know and understand. And I gather, I think exercise can help as well. Is that something that you'd recommend as well?
Oh yes, yeah, sorry, I didn't mention. So weight bearing exercise, so exercise where there's impact on your bones seems to be really important, that the impact can help bone growth, can help bone almost to reform, if you like. So, you know, really pacey walking, striding out, it doesn't have to be running, sort of lifting weights, those type of exercises also can also help. Thanks, Helen, for reminding me.
No, that's great, because I'm just wondering, if you have got poor bone health, is there anything that can be done to reverse it? Like, is there a cure for osteoporosis?
Although it's not a curable condition per se, you can improve on the bone density. So there are a number of ways that you can do that. So HRT is one of those ways, as long as for you personally, the benefits of HRT outweigh the risks. And then there is other medication. There are other medications that can be prescribed by either your GP or specialists in bone health.
Claire, one of the things that's really important to consider is for those women who experience a premature ovarian insufficiency or menopause under the age of 40. Why is it so important for them to think about their bone health?
Yes, so absolutely great question, Helen. So if you imagine that if you go through a premature menopause or menopause under the age of 40, or an earlier menopause even under the age of 45, that's far more time spent without estrogen. And we've already said, haven't we, that estrogen's really important for bone health. And so we know that the risk of osteoporosis and fractures is far greater for women who've had an earlier or premature menopause. And it just makes it so important that if this applies to you, that you have a discussion about HRT with your GP or menopause specialist, and that you continue to take the HRT at least until the average age of the menopause, age 50, 51. So you're replacing the estrogen that you would have had, maintaining your bone strength during those years. Yeah, good question, Helen.
Claire, I think we've covered all of the key points around bone health and osteoporosis today. Thank you so much for that. You've written a fantastic piece on the website around osteoporosis. People can find that under Symptom Checker if they'd like to get more information. But so important to have this conversation about bone health, given how it impacts so many women. So thanks very much for that, Dr. Clare. Thank you for listening. Bye-bye.
Bye.